So I'm going to be talking today on heart health. February is Heart Month, and so as medical professionals celebrate that around the country and do our education, I thought I'd also bring it to this platform as well. So here we go. And I'm going to touch a little bit on our famous football player as well that suffered a cardiac arrest. So please stay tuned. This is going to be a two-part series, by the way. So let's talk about how does your heart work. I'm going to get a little into anatomy and physiology. Don't be overwhelmed. So the heart is divided into chambers. You have two upper chambers called the atria and the two lower chambers, which are called the ventricles. The right side of the heart moves blood to the lungs through blood vessels, which are called your pulmonary arteries. In the lungs, blood picks up oxygen and then returns to the left side of the heart through the pulmonary veins. The left side of the heart then pumps the blood through the aorta and out of the rest of your body. So this is the right, and this is your left and the right. So what is heart disease? Heart disease describes a range of conditions that affect the heart. Heart diseases include blood vessel disease, such as coronary artery disease, irregular heartbeats, arrhythmias, heart problems you are born with, congenital heart defects, and disease of the heart muscles, and heart valve disease. So what does coronary artery disease typically look like? This is where the plaque is built up in an artery, which is the top one. The second one, some diseases, some people get what's called angina. And that's not unusual. You have a lot of people that's walking around that have this. And it's harder for the blood to get through their artery. And then some people, unfortunately, gets what's called a heart attack because the plaque cracks and a blood clot blocks that artery from allowing your blood to flow properly. What are the risk factors? Age. Now, we used to think that only older people were getting these heart attacks or going into cardiac arrest. We're learning more and more that even younger people have it as well. Sex. Men are generally at greater risk of heart disease. The risk of women increases after menopause. A family history, of course. Smoking. An unhealthy diet. Diets high in fat, salt, sugar, and cholesterol have been linked to heart disease. Other risk factors, high blood pressure. Uncontrolled high blood pressure can cause the arteries to become hard and thick. These changes interrupt blood flow to the heart and body. High cholesterol. So having high cholesterol increases the risk of atherosclerosis. And atherosclerosis has been linked to heart attacks and strokes. Diabetes increases also your risk of heart disease. Obesity and high blood pressure increases the risk of diabetes and heart disease. Obesity, excess weight typically worsens other heart disease risk factors. Lack of exercise. So being active, sedentary lifestyle is associated with many forms of heart disease and some of its risk factors as well. Stress, and here's one that a lot of people don't seem to realize, poor dental health. It's important that you brush and floss your teeth and gums often. Also get regular dental checkups. Unhealthy teeth and gums makes it easier for germs to enter your bloodstream and travel to your heart. And this causes what's called endocarditis. Now, I spoke about angina before. Angina is chest pain, discomfort, or tightness that occurs when an area of the heart muscle does not receive enough blood oxygen. So the possible areas of the chest pain will be where you see these lines are. Now, there's different types of angina. There's one that's called stable angina. This is triggered by physical or mental exertion. And it's usually resolved with rest or nitrates. Please don't diagnose yourself. The physician should be diagnosing you with this. Then you have what's called unstable angina. It's new onset or worsening angina that is unpredictable. Rest meds do not resolve this one. And acute coronary syndrome may lead to MI. Vasospastic angina, and you have microvascular angina as well. Now, let's talk about the two things that a lot of people ask questions about: a cardiac arrest and a heart attack. They're two different things. So a cardiac arrest is an electrical problem, and a heart attack is a circulatory problem. This is what a normal artery looks like, and this is what a blocked artery looks like for the person that has a heart attack. And I'm going to go more into details about that. What is a cardiac arrest? A cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. This is where people do what's called CPR. Cardiac arrest is triggered by an electrical malfunction that can cause an irregular heartbeat and arrhythmia, with its pumping action disrupted. The heart cannot pump blood to the brain, lungs, and other organs. So what happens? Seconds later, a person becomes unresponsive and is not breathing or is only gasping. Death can occur within minutes if it's not treated. So what do? Cardiac arrest can be reversible in some victims if it's treated within a few minutes. And as you saw with the football player that occurred in January. A heart attack occurs when blood flow to the heart is blocked. A blocked artery prevents oxygen-rich blood from reaching a section of the heart. If the blocked artery is not reopened quickly, the part of the heart normally nourished by that artery begins to die. So what happens? Symptoms of a heart attack may be immediate and may include intense discomfort in the chest or other areas of the upper body. Shortness of breath, cold sweats, and/or nausea or vomiting can occur. More often, those symptoms start slowly and persist for hours, days, or even weeks before a heart attack happens. Unlike with cardiac arrest, the heart usually does not stop beating during a heart attack. The longer the person goes without treatment, the greater the damage occurs with the heart. Signs and symptoms of a heart attack. Men typically have discomfort or tingling in their arms, back, neck, shoulder, or jaw. Most often men do have the chest pain and shortness of breath. Women get sudden dizziness, heartburn-like feelings. Additional symptoms in most women would be like cold sweats, unusual tiredness, nausea, or vomiting. Signs and symptoms of a cardiac arrest. The person gets shortness of breath, chest pain, heart palpitation, extreme dizziness, and then they lose consciousness. Our famous player that is known and is realizing the purpose of God on his life. And I say that boldly and openly. He was tackled and suffered what was called a cardiac arrest. This is what, when you do an EKG, the rhythm of a heart. You have what's called a PQRST intervals. Right before he gets to a T to go into a normal rhythm is when the hit occurred and sent him into a ventricular fibrillation and his heart stopped. If you notice, he stood up, if those of you that were actually watching, and then he went back and fell. What was good for him is that there was someone there, not only God, we know God was there for sure, but we also knew that there was someone that God gave the wisdom to immediately do what's called cardiopulmonary resuscitation. And that was key for this young man. The survival rate for those who have cardiac arrest outside of a hospital, and like Mr. Heyman, have bystander doing CPR is just 11.2%. For the few like him who receive immediate defibrillation, survival rates is usually up to 41%. And that's why it's encouraged, whether you're at a school or have a business, that you have what is called an AED that also can teach someone when to do compressions and when not to do it if someone collapses. Children can also have these things. Symptoms for pediatric heart disease include swelling in the face and limbs, chest pain and palpitation, decreased exercise tolerance, and shortness of breath. This is going to conclude this week's session. I'm going to continue next week by talking more about CPR, how we do CPR, how we check our blood pressure, the proper way of doing it, and what you should look for. Thank you for your time. I hope this was helpful. God bless and enjoy the rest of the service.